Sacroiliac joint pain is estimated to cause up to 20% of chronic low back pain. The treatment for this particular pain is widely acknowledged to be one of the most challenging conditions physicians face. Plus, there were few effective treatments until now. Orthopedic surgeon Dr. David Duffner reveals a new surgical technique for sacroiliac joint pain.
The sacroiliac joint is the joint between the sacrum, which is the base of the spine, and the ilium, which is the part of the pelvis. Like any other joint, the sacroiliac joint can develop arthritis. The symptoms of sacroiliac joint pain are very vague. It's just an aching discomfort in the low back and the buttocks, sometimes radiating down the back of the thigh. It can mimic sciatic pain. It's difficult to differentiate from low back pain, which can be caused by degenerative disc changes or other problems with the lumbar spine. So typically the patients, the clues that I pick up on are patients that say, I have difficulty when I first stand up. It's that transition from sitting to standing or from standing to sitting. Sitting for long periods of time causing buttock pain, that's a clue. There are certain physical examination tests that we do for the sacroiliac joint that are different than the examination for the lumbar spine or the hip joint. So this is the joint in between. This is kind of the no man's land of low back pain. And now we have a new minimally invasive treatment option that can help address this problem as well.
Dr. Duffner reviews the treatment options.
The approach to sacroiliac joint pain is much like the orthopedic approach to any joint with arthritic pain. We try anti-inflammatory medication, we try activity restrictions, sometimes injections with corticosteroids, sometimes physical therapy, sometimes a brace. And then for those patients who don't respond to empiric treatment, then we get into more specific treatment. The most common cause of pain in this part of the body is actually spinal pain from the lower lumbar spine. But if we suspect the sacroiliac joint, then we have to be very specific about the diagnosis. And that's done by doing a sacroiliac joint diagnostic injection. They anesthetize the skin, put a needle into the joint using a special kind of x-ray machine, and then they inject a numbing medicine and a corticosteroid. The numbing medicine is really the most important thing, because if it blocks the pain, even temporarily for a few hours, then that confirms that that's the pain generator. The corticosteroid may or may not help, but at least we can identify that that's the pain generator, and then we have a surgical treatment option. The new techniques involve placement of these metal plugs. These are titanium. This can be done percutaneously, that is with a small incision, minimally invasive, about a 1-inch incision. It's a 3-step operation. We place a guide wire across the joint using a special x-ray machine and multiple views for safety. And we put the guide wires in, we measure the depth, we drill over the guide wire, we punch a hole to fit the plug, and then we drive the plug in. And this creates a fusion of the joint. So what's new is the treatment, which is a sacroiliac joint fusion with the new minimally invasive technique with these small metal plugs. The results of this operation are really good. Again, it depends on proper diagnosis, but if the sacroiliac joint is the pain generator, then fusing the sacroiliac joint is highly effective. Most patients wake up and they can tell the difference because we've stopped the motion of that joint. The motion of the painful joint is what causes the pain. We stop the motion, we stop the pain. Now, naturally, there's some discomfort with the operation, but it's minimal. This can be done outpatient, and most people heal within 4 to 6 weeks. So it's a pretty fast recovery.